Hi, I'm Brenda Garza, and a brief history about breast cancer is that it is the second most common type of cancer that is found in women. 1 in about every 8 women will be diagnosed with invasive breast cancer. 1 in every 39 women will sadly pass away due to the breast cancer. The most common places that breast cancer is found is often the lobules and in the milk-producing ducts. Some factors that may contribute to the occurrence of breast cancer is being a female, the increase of age, and family history. There are other factors, but these are the most common ones that are heard of. This disease does impact women of different ages and of different races. The incident rate per the race is slightly different. The incident rate per 100,000 people with female breast cancer was highest in non-Hispanic whites with 130.8. The second leading is 126.7 in non-Hispanic blacks. 94.7 is the least so far in American Indian and Alaskan Natives. All women should be getting examined by doctors, especially if they see any lumps, size change, shape or appearance has changed. It can help reduce the risk, or if in cases where breast cancer is present, catching it early on can make a huge difference in the kind of treatment and etc.
Hi, my name is Aaliyah Horn, and there are effects to all illnesses and diseases. Breast cancer has many philosophical effects. Some emotions are just from having cancer, and other emotions are from the treatment that they have to undergo, including chemo. The biggest and most well-known philosophical effects of breast cancer patients are sadness, stress, and depression. While these are the 3 main ones, there are many more that they may have. The most common type of breast cancer are invasive ductal carcinoma and invasive lumbal carcinoma. The only difference between the two is that with ductal, they start in the ducts, and with lumbal, they start in the lubules. And so once they start in those spots, they spread to the rest of the breast, and then they'll spread throughout the body. Later on in this presentation, there'll be a photo to show where the ducts and the lubules are. Like with all cancers, breast cancer has organs that are impacted, like the brain, the liver, the lungs, or the bones. They are impacted because cancerous cells will go into them, which they can block blood vessels, they can cause bone fracture, and they can cause pressure on the spinal cord. When someone gets breast cancer, they may not think about the people around them. Well, the people around them are also affected. Families are a huge part of who are impacted. They develop stress, grief, and they want a cure for their family member, And that makes them feel anxious, including our children, which some people think that children may not understand much, but they do. Children can sense tension a lot easier, causing them to feel stressed as well. Society can also be affected. Our community is so caring and sympathetic. So they cannot do much, but they can be there for the patient, and they can hope and pray and just help out.
Some common treatments that are used to treat breast cancer includes radiation, which is given in high doses to kill off cancer cells or to shrink tumors. Chemotherapy is also used, and it is the use of chemicals to treat the breast cancer. Immunotherapy is also used, which is the stimulation of the immune system to build strength in a patient. Hormone therapy is the treatment that slows or stops the growth of cancer, and it uses hormones. All of these have horrible side effects that patients probably don't want to have, but it is very necessary in order to treat breast cancer.
So slide 13 is the anatomy of the breast, and before we can completely understand the mechanisms of breast cancer, understanding the anatomy of the breast is helpful. So A is the duct. It's a thin tube in the breast that carries milk from the breast lobes to the nipple. B is the lobe. So a healthy female breast is made up of 12 to 20 sections of the lobes. It acts as a stem or tubes to carry the milk to the nipple. C is dilated section of a duct to hold the milk. D is the nipple where milk is secreted. F is the fat, also known as adipose. It secretes growth factors and enzymes. So F is a pectoral major muscle. It's under the breast. It's situated at the chest of the human body. G is the rib cage. So focusing on the enlargement area, this the enlargement duct area, this is a normal view of the duct. So this is where breast cancer cells can like proliferate and mutate into the breast and possibly become invasive cancer. So let's see. B is the basement membrane. That's where the cells line to shape up the cell. And C is the lumen. It's a defined space of the duct. I didn't introduce myself on the last slide, sorry. My name is Javelle Kennedy, and I will be going over the normal anatomy of breast, the histological view of breast cancer, and the current research of breast cancer. So on slide 14, we're looking at stages of carcinoma and the breast cancer. So on a normal duct, we see the normal ductal epithelial, the myoepithelial, the basement membrane is intact. That's a normal duct. Moving to the ductal hyperplasia cell duct, we see that there's an overgrowth of the cells lining in the breast, but it looks close to normal. The atypical hyperplasia, the cells look more disordered than normal. It's like a precancerous condition. It's common in about 5 to 20% of breast biopsies. It's typically cured with surgery to remove the abnormal cells, the DCIS, and that stands for ductal carcinoma in situ, and that means like a position. So the cells and that line the milk ducts of the breast have become cancerous. In this stage, the cancer has not spread to the other organs just yet, and so the invasion ductal carcinoma, the cancer cells are growing in the lining of the milk ducts, and the basement membrane is no longer intact. Once that happens, the cancer can spread and the cells are dysplasia. Slide 15, we are looking at a duct from a pathology standpoint of view in a immuno lab. So for A, we're looking at a histology view of a normal duct. And we're able to see that the center point of the duct is white, the lumen is intact, the basement membrane, the circular, is intact. The simple cuboidal cells are lining the basement membrane. You're able to visibly see each nucleus of the duct cells. So compared to B and C, you're able to tell immediately that there is the simple cuboidal cells are no longer in line. It has mutated and dysplasia has occurred in B and C. If that keeps occurring, that the basement membrane will no longer be intact.
Doing slide 16, stages of breast cancer. Stage 1 is 98% survival rate. Cancer in the breast tissue tumor is less than 1% across. Stage 2 is 88% survival rate. Stage 3 is 52% survival rate. And stage 4 is 16% survival rate. Spread of cancer beyond the immediate region of the breast.